Diseases of the thyroid gland can affect practically anyone, from children to adults, especially more common in females. Let us see about thyroid gland and its diseases in today's video. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, every week, an explanation regarding a medical topic is given via a simple video. If you want to see such videos, kindly subscribe to this channel. Also press the bell icon to get instant notifications whenever new videos are released. This week's topic is about thyroid gland and the diseases affecting it. Thyroid gland is an endocrine gland or a gland producing hormone. Hormones are chemicals which are released by these special structures called endocrine glands. Thyroid gland is situated in the front part of the neck. It is often called butterfly or bow tie shaped. This gland produces a hormone called thyroxine, which is essential for every tissue in oxygen utilization and in protein production. Because oxygen utilization is there in all tissues, the functions of thyroid gland extends to all systems, in growth, in neurological system, in fertility, in reproduction, in gastrointestinal tract, in skin, practically every organ system in the body. Similarly, diseases of the thyroid gland are going to affect every organ system in the body. When we speak about thyroid gland, the diseases of thyroid gland occur more often in women to the tune of like 80:1. So, more women are affected by thyroid diseases than men. So, when we see about thyroid diseases, what we are going to see today are three classes of diseases. One is decrease in thyroid hormone production, otherwise called as hypothyroidism, which can be congenital or acquired, hyperthyroidism, and lastly swelling of the thyroid gland called goiter. Hypothyroidism, that is decrease in thyroid hormone levels, can be congenital, that is which is present since birth. Since thyroid hormone is essential for neurological development, we may think the child will be abnormal at birth, but luckily thyroid hormone passes through the placenta from the mother to the child. So usually the newborn is not so much affected by decrease in thyroid hormone, but once the child is born, it no longer receives the thyroxine from the mother. Hence, if it is not treated urgently, it may lead to permanent neurological damage. In fact, thyroid hormone deficiency is the commonest cause for preventable mental retardation. Any causes of mental retardation cannot be prevented. This is one instance, if diagnosed early, where you can prevent developmental delay, neurological system delay due to thyroid hormone deficiency. Many of the signs may not be present at birth, but what are the signs and symptoms? The child may have a delay in passage of meconium. The meconium, which is the first stool pass, which is usually black in color, may be delayed in cases of children who have thyroid deficiency. They can have a coarse, dry skin. They may have a hoarse cry. They can have umbilical swelling called umbilical hernia. Neonatal jaundice, which is usually normally present, can be prolonged in cases of children with hypothyroidism. So all these, child may be essentially born normally, then they develop subtle signs and symptoms. Only problem in congenital hypothyroidism is, if you don't diagnose it early and start treatment, it may lead to permanent neurological damage. Hence, we don't wait for the signs and symptoms to appear. Instead, what is advised is universal neonatal screening. That is, all newborn children are screened for the presence of hypothyroidism. If it is present, you start treatment. How do you diagnose? Simply, every child, a blood drop is drawn from a heel prick and a blotting paper which absorbs this blood is sent for hypothyroidism screening. Not only for hypothyroidism, many other disorders which are rare but which can be treated if diagnosed early can be identified by this neonatal screening method. If there is an abnormal result, you confirm it with a specific blood sample. You may also do some imaging or scans, and if diagnosed, you start treatment with thyroxine, which is a synthetic thyroid hormone taken orally as early as possible. Coming to acquired hypothyroidism, acquired hypothyroidism is hypothyroidism which is not present at birth but which develops later in life. whether in childhood, adolescence or as adults. Commonest cause for acquired hypothyroidism 2 decades ago was iodine deficiency. Since iodine is essential for thyroxine production, lack of iodine in soil, which is the only source. We get iodine through food and water. If the soil lacks iodine, there may be iodine deficiency which predisposes to acquired hypothyroidism. Since mandatory iodization of salt started in 2006, this cause of hypothyroidism is on the wane and practically now doesn't exist. Now the commonest cause for hypothyroidism is autoimmune thyroiditis. Our own immune system acts against our own cells and start attacking it. Common form called Hashimoto's thyroiditis is the reason for acquired hypothyroidism these days. What are the signs and symptoms in this? As I said, for a newborn, those signs are also present like dry skin, dry coarse hair. You may also have constipation. You may also have menstrual problems. Maybe weight gain, so the person may become obese. You may have cold intolerance, meaning others are tolerant to the temperature in the surroundings. The person with hypothyroidism feels cold, probably asked to switch off the AC or the fan. So this kind of cold intolerance may happen in hypothyroidism. So if your doctor suspects hypothyroidism, they may order a blood test which will identify the presence of it. To identify the cause, they may further do some more blood tests as well as imaging, that is scans. And the treatment for this will be very simple. Replacement of thyroid hormone. A synthetic thyroid hormone, thyroxine, is replaced, taken every day orally, usually in the empty stomach in the morning, which alleviates the problem. But the most important concern is many of these conditions tend to be present for a long time or even permanently. So you may have to take the treatment continuously, follow up for the control through blood test and continue taking treatment. Many of the patients stop taking treatment, that may lead to problems. The second condition is hyperthyroidism, where there is excess production of thyroid hormones. Usually this leads to opposite effect of what happens in hypothyroidism. So you may have diarrhea, that is frequent stools. You may have menstrual problems. You may have heat intolerance. They may become thin. Even if they eat normally, they become thin. They are anxious, nervous. They have tremors. So all these symptoms can be present in hyperthyroidism. Peculiarly, few people with hyperthyroidism can have a staring look. Their eyes may look bulging. So if any of these signs are present, again doctors diagnose it via blood test and you may need to take treatment in the form of anti-thyroid drugs. Third problem is an enlargement of the thyroid gland or a swelling in the thyroid gland. Swelling in the thyroid gland is called goiter, which can be normally present usually around puberty, which may later subside without any treatment. Sometimes, usually in the later life, thyroid gland can have swellings which are benign, are not cancerous, as well as swellings due to cancers of the thyroid. Whenever you have swellings in the thyroid, you need to visit the doctor immediately. Some of the symptoms which can predict whether the swelling is cancerous or not are change in voice, difficulty in breathing, difficulty in swallowing, or lymph nodes in the neck. Whether these signs are present or not, any swelling in the thyroid, kindly visit the doctor to ascertain the cause and to remedy it accordingly. As I said, the pubertal thyroid swelling may be totally normal, it may be ignored. Thyroid swellings which are not cancerous sometimes may require surgery. Rarely, thyroid swellings which are cancerous may require surgery, chemotherapy and radiation depending upon the type. Anyway, treatment is definitely possible. You need to seek the help of the concerned doctor to get the proper treatment. Today, we have seen about thyroid gland and the diseases affecting the thyroid gland. If you like this video, kindly share it among your friends and relatives. See such videos, subscribe to this channel. Till we meet again, bye.